guys, my name is Caitlin. I'm going to be demonstrating a head-to-toe physical assessment that's expected for your lab at Ameritech College. So we're going to get started. Hi Andrea, my name is Caitlin. I'm going to be your nurse today, and we're going to just be doing a quick head-to-toe assessment. Is that going to be okay?
Yeah.
Okay, if you have any questions at all, just jump in and let me know. I'll try and verbalize everything that I'm doing. So I'm going to first provide privacy. We don't have curtains, so I'm just going to pretend to pull a curtain here. Is that okay if my instructor's in the room with us?
Yeah, that's great.
Perfect. I'm just going to do the hand hygiene. So before you got here, we took your height and weight, your vital signs, so those are all documented in your chart. Just to review with you, your blood pressure was 108 over 60, your pulse was 58, your oxygen saturation was 95, your temperature was 37.0, your respiratory rate was 16. So everything's great within right where we expected. So I'm just going to start with the assessment notes, asking you a couple questions. Can you tell me your full name?
Andrea Evans.
And how old are you?
37.
Perfect. And do you have any drug allergies?
Just to Percocet.
Okay, we won't be giving you any Percocet then. What gender do you identify as?
Female.
Okay. And do you have any other medical diagnoses or chronic conditions that we need to know about?
No, I'm pregnant right now, so that's my biggest thing. And other than that, I don't have any other diagnoses or concerns that I'm aware of.
Okay. So, like I said, we already got your vitals, so I'm just going to skip to the next portion. I'm just going to ask you a little bit about if you've been having, I know you mentioned before we started, you've been having some back pain. Can you tell me a little bit more about that?
Yeah, it's been in my lower back. It probably started about 2 weeks ago.
2 weeks ago, okay. Mm-hmm. Does it happen throughout the day, or how would you describe the frequency?
Yeah, on and off throughout the day, mainly at night. I wake up with it a lot.
Okay. Have you found anything that makes it worse?
Not really worse, but I think position changes have helped make it better.
That alleviate some of it?
Yeah, like being in certain positions for extended periods of time, which is why at night when I'm sleeping, I think I wake up with it and stuff.
How would you describe like the characteristic of the pain?
Dull, kind of achy.
Okay.
When it's starting to hurt.
Okay. Do you have any pain right now?
Right now, no.
Okay. Mm-hmm. So if you did, we'd have you rate it on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you can imagine, and 5 is right in the middle of I like to tell people it's about when they want to cry. So that just helps you understand our pain scale. While you're here, we like to have what's called a pain goal. It's where you're comfortable with your pain being before we intervene. Where would you want your pain goal to be?
0.
Okay, I think it's a great goal.
Yeah.
Mine too then. Okay, perfect. Let's get started then. So I'm just going to start at your head, and we'll just kind of move down. So first I'm just going to palpate here. Your hair is equally distributed. Any hair loss that you've noticed or anything?
No.
I don't notice any bumps or lumps, any pain when I'm doing this?
Nope.
Okay, I'm just going to come down and feel your neck. Your trachea is midline. Your lymph nodes don't feel swollen at all. Any tenderness?
Nope.
I'm just going to use this light here. Just going to shine them in your eyes. Sorry, it's really bright. Perfect. Your pupils are reacting to the light. They're equally round and reactive. I'm going to have you follow my finger to check your cardinal fields. Perfect. Then I'll have you look at my finger and then just look beyond it. And look at my finger, look beyond it, perfect, and your accommodation's intact. So that's Perla, and then I'm just going to use this light to shine up your nose. Perfect, no discharge in your nasal mucosa, looks healthy, no polyps, the septum's right midline. I'll be open your mouth, no dental caries, the oral mucosa is pink and moist. I don't notice any ulcers or lesions or any breakdown I'm worried about, so that's all good. And I'm just going to look at your external ear. Perfect. Any pain as I'm doing this?
Nope.
Okay, everything looks good. There's no discharge there. Okay, perfect. So let me just ask you a couple of questions. So there's a lot going on right now with the coronavirus and everything. in the world. How have you been coping with all that? And do you have any other stressors kind of going on?
I feel like I've been coping with it pretty well. I mean, my biggest stressors are a toddler at home, being pregnant, and working part-time, and balancing it all. And my husband works full-time with, stay at home and quarantine. But other than that, I feel like I've been coping pretty well, dealing with stressors as they come.
Good. How's your mood been?
Pretty good. Some days, I think like anybody.
Yeah.
You have a rough day. But overall, I think pretty good.
Do you have ever any thoughts of hurting yourself or others?
Nope.
Okay, good. And your affect looks great and appropriate. So now I'm just going to continue with some questions. These kind of feel silly. This is just how we assess your orientation.
Okay.
So you already told me your name. Do you know where you are?
I'm at Ameritech College.
Perfect. And do you know why you're here?
To have a physical health assessment.
And what day of the week is it?
Sunday.
Perfect. Okay. So you're oriented times 4. I'm just going to see if you can follow commands for me. I'll just have you put your hands out and squeeze my fingers. Perfect. Your grip is equal bilaterally. That's what we want. And your speech has been rhythmic and to be expected. So that's all good things. So I'm just going to now listen to your heart and lungs, if that's okay. So I'll have you sit up. That's the best way for me to listen. So we always like to listen with the stethoscope right on the chest, right on the skin. Because of the situation, though, and you're not in a gown, we're just going to listen over your shirt in some locations. But it's best practice to listen on skin. So I'm first going to listen in the aortic position, which is the second intercostal space on the right side of the sternum. Perfect. Then pulmonic. And then herbs. Tricuspid. Mitral. Perfect. So the rate sounds regular. The rate is okay, I'm sorry. The apical rate is about 60 and the rate is regular. I don't hear any rubs, gallops, or murmurs, so those are all good things. I'm going to now listen to your breath sounds, okay? Little tongue twister there. Let me take a big deep breath in and out. Perfect. And again. Perfect. Let's lateral lobe. Listening on 6 spots on the back. Perfect. So your breathing doesn't appear labored at all. Your lungs sound nice and clear, no adventitious breath sounds. Have you had a cough recently?
No.
Okay, good. So if you do happen to cough, you don't cough up any sputum?
No.
Okay, perfect, good. I'll have you lay back. And now I'm just going to listen to your abdomen. We're going to listen in all 4 quadrants. Okay, everything sounds good. And I'm just going to gently palpate. I'm inspecting and I don't notice any mass in the abdominal contour. Looks normal. And I'm just going to gently palpate. Let me know if there's any pain or tenderness. Okay. A little uterus there. Okay, perfect. When was your last bowel movement?
Yesterday.
Okay, was it normal?
Yeah.
Okay, normal color and consistency?
Yeah.
Have you been having any constipation or loose stools, anything like that?
No.
Okay, perfect. And then as far as your bladder, are you urinating okay?
Yeah, probably more so just increased frequency because of pregnancy.
Yeah, and we can expect that. Any burning when you urinate?
Nope.
Any changes in color or any odors, have you noticed?
Nope.
Okay, good, perfect. And you don't have a catheter in. You also don't have any IVs, any sores that I'm worried about. Your skin looks intact. No dressings that we need to assess, and no drains. So that's all perfect. I'm going to just quickly assess your skin here. So there's no edema, and your capillary refill is intact, and I'm just going to feel your pulses here. They're nice and equal, 2+. I'm just going to feel down here on your legs. There's no swelling at all. Just going to feel your pulses. Wonderful. And then just gonna your turgor, perfect. And your skin feels nice and moist. It's not dry, and the color is within normal limits of what we expect. So yeah, everything looks great there. I'm gonna now have you sit up, and we'll just check your range of motion. Can you move your arms in circles for me? Perfect. Any pain with that?
No.
Okay, then I'll have you stick your arms out in front, and then push them out to the side. And bring them in. Perfect. And then I will have you... Oh, do you use any assistive devices?
Nope.
No. Any history of falls?
No.
Okay, I'll have you stand up. And we'll just have you take a few steps forward. Assessing your gait, and your posture looks excellent. Great. Okay, you can take a seat back down. I'm just going to assess the strength of your legs. I'll be pushed out. Perfect. Now pull back in. Great, they felt nice and equal in strength. Let's see, I think that's everything then. Do you have any questions or concerns?
I don't.
Okay, can I get you anything?
No, maybe just leave my call light.
Okay, your call light's there. Just going to do some hand hygiene. Let me know if you need anything, okay?
Okay, thank you.